with Healing Rosie, and my special guest today is Dr. Anna Cabeca. As you guys know, super excited for this interview because this is a topic that in our community we love to talk about. Every day it seems like I've got posts and emails coming in from women who have questions about how to navigate basically the change of life, probably mid-30s through 50, early 50s, depending on your unique biology and the environmental stuff that's affecting how you're navigating that menopause journey. We have lots of questions here for Anna that I'm super excited to dive into, and would love to hear from you. So if you have a question for Anna, feel free to drop it in the comments below, and I'll do my best to get to all the questions. But in the meantime, Anna, welcome. So glad you're here.
Thank you. I'm thrilled to be here. So thanks for having me. It's nothing I like talking about better than hormones and healing from them as well. So thanks for having me.
Yeah, well, we like talking about this too. And I'd love to just kind of start off this conversation with maybe an overview of your mission and why you're doing this. In the comments here, you guys, you'll see that we've got links to a masterclass that Anna's created around hormones, and also a free ebook to really support you in understanding what's happening with this phase of life and this time in your life. So Anna, why don't you just tell us a little bit about kind of your mission in this area? And I'd love for you to kind of touch on like I wouldn't say preventative, but I think the thing that comes up often in these questions, and women will see other women talking about these crazy challenges they're dealing with as they're getting older. And it comes back to like, how do I keep that from happening? So why don't you kind of frame all of this for us, and then we'll dig into all these questions.
Yeah, thank you. Well, one of the things is, I suffered myself, and as a physician, I'm Emory University trained gynecologist and obstetrician. And I was diagnosed at age 38 with premature ovarian failure, early menopause, and told that I would not be able to have another child. And the only option for me at that point was egg donation. So that led me on a journey of discovery and healing that I never anticipated. So with that, I've now been triple board certified. So I'm board certified in integrative medicine and anti-aging medicine, as well as really becoming an advocate for each of us to be empowered over our own health. Because as a result of this information that I learned naturally, I was able to conceive a healthy baby at age 41 and reverse menopause completely for at least another decade. And now at age almost 53 with a 10-year-old at home, I'm really a big advocate for women as we go through these changes to stay empowered. Because the statistics are sad. At age 50, the average, women are on an average of 3 prescription medications. Quality of life starts to decrease. And in a recent survey, it looks like women in their 30s and 40s are willing to make changes. But by the time we're getting into our 50s, we're powering through, we're bearing with it, and we feel like there's not much available for us. And that's just not the case. We can have a better quality of life. So for me, going from a point where I struggled, but not only that, I saw my mom struggle. I saw her struggle with heart disease, diabetes, depression, and the list goes on. And then struggling the last 15 years of her life and dying prematurely at age 67. That doesn't have to be the case. That was over 22 years ago. And everything I do and everything I teach is about that empowerment, is about what strategies we can make now naturally that put us in a state of absolute physical health, spiritual health, mental health, and relational health, which is so key. Because when we don't feel good, we don't like anyone, let alone ourselves, right? And so it's really important that we just start to be the champions of our own health.
Yeah, well, what you're saying is resonating with me, because as many of the women in our community know, I had a similar journey where at 38, I was diagnosed with premature ovarian failure after they removed my left ovary when I was 35 because of an endometrial cyst. So I was on that total roller coaster myself, trying to get help. And, at that time, that was the first time I got a referral to someone who could put me on bioidentical hormone replacement therapy, which was really helpful in my situation. But I was surrounded by like a minefield of doctors who weren't helping me on the left and doctors who weren't helping me on the right, and not really acknowledging what I was going through as something that needed legitimate care. You know, I think there's almost this resignation in the medical community that women get older and these things happen, and it's just kind of a part of the journey. And it's very, very disempowering to women. So I feel like I'm 43 now. I feel like I've been in the fight of my life around all of this stuff because my quality of life was impacted so significantly. I mean, when your hormones are low and your labs are showing things like premature ovarian failure, like in my instance, I was having trouble sleeping at night. I went through a phase where I gained mysteriously 45 pounds in 3 or 4 months, which I found out later was due to heavy metal toxicity, having the mercury fillings improperly removed. But of course, you know, at that phase of life, that totally had an impact on my hormone health. And, you know, I figured a lot of things out on my own just by being in this community and being so tenacious about advocating for myself. But I certainly didn't learn these things from my doctor. And that's really what I want for our sisters here in the Healing Rosie community, is to understand how they can navigate this and advocate for themselves, because so many doctors aren't going to give them the message that we're going to be talking about today and give them these tools and really empower them around their own journey. So why don't you give us like a sneak peek into some of the things that you did that were really effective in managing something like premature ovarian failure and all of the other conditions that come along with entering menopause prematurely?
Yeah, and you know, this several things that you said also was part of my journey. That experience, you know, so many patients of mine would come to me and say, Dr. Anna, I'm gaining 5, 10, 20 pounds, your case 45 pounds, without doing anything different, right? That mysterious weight gain, like what the heck's happening? And certainly I saw that, and lo and behold, then it happened to me. You know, here all of a sudden I'm gaining 5, 10, 20 pounds. And that's after losing 90 pounds, after being 240 pounds overweight, losing that when I reversed menopause the first time, and getting a handle of it and keeping it off for nearly a decade. And then at age 48, hitting that again and just seeing that mysterious weight gain. I like how you say that. And so it goes to uncovering the mystery, solving our own mystery, what's going on in our body and how we can dig deeper. Because when we think about these hormonal changes, we think, okay, yes, loss of fertility, but along with that, we have the loss of a good night's sleep, which is when our body needs to be resting, restoring, and repairing, right? That's an anti-aging time for us, better than any pill. So a good night's sleep. And then we have the hot flashes, the night sweats. I mean, I can so remember laying awake, you know, covers on, covers off, tossing, turning.
It's miserable.
Miserable, right? Miserable. And yet you power through the day. We power through everything on our checklist for the most part, except for the have sex at night with our mate, which is the last thing on our sex list. And we're like our checklist, and we don't get there. But again, that's a really important thing. And I teach that. But for going through, like, I think it's more than, for so many physicians, like there's a combination of holistic health and, our, you know, Western medical health, and where we as physicians, we really need to continue the learning, continue beyond what we can do with a prescription pad and a surgical knife, right? We've got to go beyond that in order to heal. And through my personal journey and what I witnessed my mom go through, I knew that was my mission. That was what God's put me on this life to do in so many ways. And that's to empower everyone listening to be, you know, healed, to be healthy, to have good relationships, and it can be done. And so my doctor's bag is now quite big, right? There's a lot of tools in it, and nutritional recommendations and you know, health tips and pearls from around the world. And that's been part of my journey. So we don't have that. And it's for us to expect our doctors to give it to us. We can't. We have to do this ourselves. And 90% is in our control. And that's, you know, when we need the physician for the crisis situation, for the, you know, hey, there's nothing wrong with you yet statement, you know, we need our physicians for that. But to keep ourselves healthy, I really say that is our responsibility, because now we have the tools and the knowledge to do that. Now, sometimes we do, and I'm an advocate for bioidentical hormones. But it takes more than hormones to heal our hormones, because if that wasn't the case, everyone on thyroid hormones would be thin. but we know that's not the case. So it takes more than hormones to heal our hormones. And that's a really important part of what I teach and what I put now in my book, The Hormone Fix, because I want everyone to have this. And that's something, you know, we need to read through, look at the pearls, understand what I call my keto green way to empower nutrition and lifestyle to help our body become in alignment with its design. And give this book to your physician, because they need this information too. They are inundated with everything they have to do for your insurance companies, for the medical board, for the hospital, for, you know, I mean, the list is on, but giving them a concise packet of information makes a difference. Because in 1999 or in 2000, someone gave me Dr. Christiane Northrup's book, Women's Wisdom, Women's Bodies, Women's Wisdom. And that was eye-opening for me. It's like, oh, here's another OBGYN saying outside the box things. And this is what I've been thinking. And that just dug me further to help advocate for my patients. But again, that was also my personal journey. I had to for myself, and I had to for my patients.
Yeah. So why don't you just go back to that time and when you were getting these diagnoses, what kinds of things did you do to get yourself on the right track?
So definitely, first and foremost, detoxifying my body. So that's a big, well, actually, first and foremost, not giving up hope. Not giving up hope. I was told I was completely infertile, yet I didn't give up hope. I kept looking for answers. And that's the first thing. Don't give up hope. It doesn't matter how old you are. I've had clients in their 80s live a better life. So we cannot give up hope. That's number one. And number two is to detoxify our bodies, remove the toxins. Like you had the heavy metals. We are exposed to so many toxins, and on a daily basis, the average woman using regular products is exposed to 140 chemicals before she leaves the house in the morning, between soap, shampoo, toothpaste. I mean, just name it. There's tremendous amount of chemicals. We have to be conscientious consumers and remove those toxins. I put a chapter of that in my book because the, you know, discovery process, right? We have this mystery going on that is our body. We need to discover what's causing these mysterious symptoms and get to those root causes. So part of that was detoxifying my body. And by doing so, choosing alkalinizing nutrition, checking urinary pH, which I'm a huge advocate of, checking urinary pH to see that we have a urinary pH 7 or greater. And I created little test strips that measure pH and ketones, because that combination is really important. And to just look and see, how is your body responding to nature, to the environment, to the diet? Because it's not just what we eat that affects our urinary pH. That's really important to understand. But as we improve it, and now I've led thousands of women into that discovery process, as women recognize and improve their urinary pH, the alkalinity of the urinary pH, they feel better, think better, live better, are more hormonally balanced, experience less hot flashes, and the list goes on. So that's important, detoxification. So number one, don't give up hope. Number two, detoxify your body, and in so doing, work to increase the alkaline-rich foods in your diet, as well as the lifestyle practices like meditation, getting out in nature, resetting your circadian rhythm, getting a good night's sleep. All of those come into this powerful detoxification process. So that was the second thing. And then bioidentical progesterone. I use my Pure Balance PPR cream now regularly, not cycling anymore. So pretty much Monday through Friday or Monday through Saturday. And if you're cycling, it's typically the from after ovulation to your period starts, or day 28. So bioidentical progesterone was another big aspect. And then adrenal adaptogens too, to support my body's own natural production of hormones with the earth's healing foods. And create, and I didn't have anything. I found ingredients from around the world as part of my journey, and I put them together in a product because I didn't have natural options for me or my patients, and certainly not in 2000.
Mm-hmm. Yeah. So when you talk about cycling progesterone, one of the things that comes up is once women get into perimenopause, you don't have regular periods anymore. Sometimes you're going a long time between periods. Sometimes your periods are coming closer together. I actually, I've been doing a lot of healing around my hormones. So in 2017, I had 3 periods for the year. Last year, I had 1 period in January, and then I started having periods that came really close together starting in June. And June until the end of the year, I was getting my period every 2 to 4 weeks. It was crazy, coming so much. And of course, you know, in looking at things, it's like, we need to dial back estrogen, but I was doing BioT at the time, and you have to kind of wait for all of that to move through your system. But all that to say, when you're in this situation where your periods aren't regular, or you're doing a lot of healing protocols like I've been doing to kind of get that hormone production back, how do you navigate the cycling thing? So many things are timed according to cycling, except your cycling isn't consistent.
Exactly. And that's always a challenge. So there's a couple ways that I work through that with my patients. And one is, if you're having frequent cycles, sometimes it's worth using progesterone every single night for 2 to 3 months until that kind of resets the endometrium, the inside lining of your uterus. So we can use it that way, whether you're prescribed oral progesterone or you're using a topical progesterone formula. So using it every night for 2 to 3 months just to kind of reset the endometrium. And that typically will really help with that frequent irregular cycle, typically. And then cycling. So if you're having infrequent, when you have a period, wait 10 to 14 days, depending, and start the progesterone cream. Unless you're having it, like I said, every 2 to 3 weeks, then you just want to go full on for 2 to 3 months. And that typically helps your body reset. So then from the day you first start bleeding, that's day 1. And I would wait, typically, if you're trying to get pregnant, wait till after ovulation and then start. If pregnancy is not a factor, then you may want to start as early as day 8 or 10 and just use it every night until day 28 or until your next first day of bleeding. And you can do it that way periodically. You can do it that way for a while, and your body will catch on. Your body will be supported in this rhythm.
Mm-hmm. So, so you're saying, if I want to make sure I understood what you said, if you're, you do that 2 or 3 months resetting and then just kind of wait as if it's going to be normal and start dosing that way?
Yes. Yeah. So like if you have that frequent period, just 2 to 3 months of every night progesterone, and that should just definitely help reset your endometrium. And from that point, if your periods are back to normal, then you would just go on the 28-day cycle. So from day 10 to 14 starting till day 28, or till your period starts. Some of us it's day 32, some of us it's day 42. So then I would support your body's progesterone in that way. Mm-hmm. And if you're like every 3 months, then I would just go on a rhythm of day 1 through 25 until your period comes. And then when the next period comes, wait 8 to 10 days and then start the progesterone again.
Mm-hmm. One of the things that comes up in our community a lot is what kind of bioidentical hormone carrier is the best. You know, obviously there's BioT, there's topical, there's oral, there's vaginal, there's just all these different kinds. And women are, you know, constantly asking like, what is the best way? Another thing that comes up a lot is women who have been on bioidentical hormones and they feel like, you know, they're getting older, they're getting, you know, further into menopause. A lot of times these are women in their 40s, mostly, I would say, that are asking these questions. Like, do I need to have it as a goal to get off of hormones? You know, like, is it bad that I'm on hormones, or how do I transition off of them? So 2 questions there. First, what kind of hormones, you know, what kind of bioidentical hormone and in what mode? And then the second, should I plan to get off of them?
Yeah. And I'm going to start with the second first, because like when we talk about hormone therapy, often if we're having irregular cycles, you know, one of the things that a physician will do is recommend birth control pills just to kind of get your control, you know, when your period's coming. And often I hear, you know, women being recommended, well, you can stay on it through, you know, age 50. And then, you know, when we think you're through menopause, change you to hormone replacement. And that's a mistake, because those are, that's synthetic progestin. It's not bioidentical progesterone, and it's more estrogen than we need to be taking. So that's a couple factors that can affect us. Plus it's suppressing our own ovarian cycle, and which is a very important part of our entire hormonal communication system. So I don't recommend that form of hormone replacement therapy, okay? But for bioidentical, when we talk about bioidentical, certainly there are pellets like testosterone pellets. I'm not an advocate for estrogen pellets, but testosterone pellets are an option. And I would always say, Misty, that sometimes clients, two patients will come in, same age, same complaints, and go out with two entirely different treatment regimens because, you know, of their unique situation, of their lifestyle, of their capacity at this time. So for women that are really struggling hormonally, struggling with libido, struggling with doing, you know, taking a vitamin every day on a regular basis, pellets are an option. And I err on the lower side, 75 to 100 milligrams for 4 to 6 months for a testosterone pellet in women. If we just need to kind of take that out of the equation, at least we're covering you, we're giving you a boost until we can do something a little bit more tailored and a level, because even with pellets, you're getting highs and lows, same with injections, highs and lows. Because another option is certainly testosterone injections when we're talking about prescribed testosterone therapy. So those are a couple options. And I like low dose, like 10 milligram a week testosterone injection in women if we're going through, we need that additional support. Mostly I recommend troches, which is spelled Troches. And these are like lozenges that dissolve between the cheek and the gum. And that's a nice way to combine some of these hormone replacement mechanisms. Plus, it's in the, you know, we're not putting it on our skin and then transmitting it to our kids. So if we have children at home, I'm not a big advocate of transdermals. We have to be very conscientious about transdermal testosterone when we have, and estrogen when we have children at home. So we want to consider that. Do you see? So it's really, that's a loaded question. It's taken 20 years to really get the art of the science down for me. But those are some of the pearls that I recommend. So with troches, we can combine some bioidentical progesterone, low dose testosterone, even a little bit of DHEA if we need it. So that's the option. And when we need estrogen, you know, replacement, to add in estrogen replacement, because we know we need to maintain these healthy hormone levels, but never just to take hormone replacement without doing all the functional medicine principles, the lifestyle and nutrition aspects that are so important, because what comes in has to go out, and it has to go out healthily. And so that's from liver detox, from the bowel, from cell membrane health. And I go into that in detail in my book, The Hormone Fix, because I really want to emphasize those aspects that improve the quality of our life and the quality of our health beyond, you know, simply taking hormones.
Why don't you recommend the pellets for estrogen?
Because they tend to get really high and they exit at a different time than testosterone. So women have this gap time typically between estrogen and testosterone. The only time I would recommend an estrogen pellet is in women who's had a hysterectomy, because also those high levels of estrogen on the uterus tend to have adverse bleeding effects. On ultrasound, I would often see a thickened endometrial stripe, and that also we know increases the risk of endometrial hyperplasia or puts them at risk for endometrial cancer if we're not doing other things. So testosterone pellets by themselves, typically in my practice, I found that to work better, and I could do estrogen if the client needed it, and progesterone with a troche or a transdermal or orally. So I kept testosterone separate, because also depending on that client, if we are giving estrogen pellets or any type of estrogen, we need to know their estrogen detoxification score. We need to know how their body is detoxifying estrogen. So to put a high dose pellet of estrogen into someone and not track their urinary estrogen metabolites or blood estrogen 2,4,16 hydroxy estrogen and methoxy estrogen metabolites, to be exact, if we're not looking at that, we're doing the client a disservice. We need to look at how they're metabolizing estrogen. And even just that impact of those, you know, that high level I found can adversely affect their detoxification score.
Yeah. Okay. So another question about this. The testosterone you just said for BioT, rather, you just said 4 to 6 months. In the doctor's office that I go to, they recommended every 3 to 4 months. And my experience was, when I decided I was going off because I could tell that my body was having weight, I was getting too much. I did labs in November, I believe, and I still had high testosterone and estrogen, which was 6 months later, you know? And so I just got labs done again last Friday, actually, and we'll see where they are. So I am not doing testosterone or estrogen right now because I'm trying to get those numbers to come down. But I just want to point this out from a trenches perspective. I had an experience where they were telling me more frequent, and you just gave a window that was less frequent.
Yeah, and before I would reinsert pellets, they would also a week or two before their scheduled appointment get blood work done. So I would look at their free and total testosterone, sex hormone binding globulin, estrogen and/or estrogen metabolites to look at their estrogen detox, and then determine how much, if any, pellet when I'm putting it in. Exactly for that reason, because we're not doing physiology affects our behavior. High levels of testosterone in men and women can cause that dopamine seeking behavior or novelty seeking behavior. And something I always tell my clients, like if it's affecting like who you are as a person, I mean, that's not okay. We want the lowest effective dose that we're getting therapeutic results with. So I'm an advocate of that because I've seen those behavioral changes occur in clients. You know, I've had many clients come to me who've been on pellets and especially on estrogen injections that took us sometimes over a year to get them to normal ranges. So it's a challenge. It's a challenge. We don't want to affect people's mind in that way.
Yeah. One of the things that I just want to say here, there's so many clinics now, hormone clinics that are promoting BioT and similar therapies. And I feel like it's a money-making machine rather than a real effort to help women stabilize, and they don't do nearly enough testing and monitoring. And so I just want to kind of buyer beware to women that if you're going to go the bioidentical hormone therapy route, that you're really working with someone who's committed to testing and really watching how your body responds and not oversimplifying, you know, the dosing of hormone therapies, putting numbers in a machine and saying that's the way you should do it, because a lot of women have gotten wrecked by that approach. And while I trust my doctor that is working with me on bioidentical hormone replacement therapy, I definitely feel like I'm the one leading my care a lot more than my doctor is. You know, it's my advocacy and my really paying attention to my labs and being educated that kind of keeps me on that straight and narrow. And I want that for my sisters too. So.
Yeah. And I think the best way to find someone who's more in tune with, you know, a natural approach is word of mouth too, is to really ask, and definitely can email me and I can give some recommendations, but someone who's in it with a functional medicine approach, right? That's really key, because we want to we can't just look at one thing. Like I said, it takes more than hormones to fix our hormones. So we have to look at these other aspects. It's not just what's coming in our body, it's what's happening once we get it. And what I found through my now nearly 30 years of clinical experience, right, in medicine and as a hormone expert for almost 20 years, is that, you know, we benefit from a holistic and integrative approach. So my approach is to give the detox the body, give the adaptogens, like the products that I created. Mighty Maca Plus is one. Maca is a great adrenal adaptogen. And it's also adding in quercetin, turmeric, greens, enzymes, fiber, all those different things that we need to help our body healthfully detoxify hormones as well. So that's key, adaptogenic support. And adding progesterone and DHEA by, you know, through transdermal is my preference at this point, because now from thousands of women that I've helped in my online programs, they've gotten better with just that, right? They feel fabulous with just that. Rarely do we need to add on testosterone and estrogen, but sometimes we do, but rarely do we need to. And so that's the fine tuning. And when we do, we start with lower doses and, you know, monitor frequently and see how we need to adjust from there, because I think those are the things that make a difference. That's the art of medicine and working with our client. But again, I will tell you this, that if I had a client who was like, you know, driving through for their meals, sedentary, not an advocate for their own health, the last thing I would give them would be hormones, because you've got to make those committed changes to your health, because there are side effects to everything that we give. And again, those detox detoxification pathways have to be open. Regular bowel movements and you know, hydrating well and doing these other aspects that really make the majority of the results, the best results that we'll get.
Mm-hmm. So you just said something that was really intriguing to me. You talked about using DHEA and something else, I missed it. As precursors, progesterone, those are the two. And
Yes.
you just make adjustments with those only. I'm assuming DHEA would be like the precursor to testosterone. So the idea would be that supplement with those and let your body convert as it needs it. Is that the angle you're going for?
That's an upper level approach, right? So we want to do things that are going to increase our DHEA naturally and increase our body's progesterone naturally. Because the ovaries, even, you know, the ovaries are producing progesterone and DHEA through the menopause, but our adrenals take over after that. And so these are essentially, progesterone's a mother hormone. And like from cholesterol, we get progesterone and pregnenolone. When we're under stress, we get shifts to cortisol. Well, when we're stressed, we know that down here, estrogen and testosterone, if we're using up our mother hormones to make steroids or to make cortisol, we're going to have less of the reproductive hormones, hence issues with fertility, fatigue, muscle wasting. We get into this catabolic state, this breaking down state. And well, that makes sense. No time to, you know, it's not a condition to reproduce in if you're under stress. So we lose those hormones, hence premature ovarian failure, early menopause, hot flashes, mood swings, PMS, hating your husband 2 weeks out of the month, which I always say is your hormones, not your husband, right? Can all occur because of that phenomenon, the shifting of the hormone pathways to be life-sustaining, right? And so essentially supporting stress hormones, cortisol, okay, our natural anti-inflammatory. And DHEA is down, like if we look at the pathway, progesterone, pregnenolone, cortisol, DHEA, estrogen, testosterone. So DHEA from the adrenals, a precursor to estrogen and testosterone. And so again, it can be very beneficial. And so the results that we know that the higher our body has of natural DHEA, we have improved brain, a decreased risk of cancer, better metabolism, you know, and the list goes on. So I would say healthier breast, brain, and bones. So from healthy levels of DHEA. So I would start there. But again, because so many people aren't looking at their hormone metabolites, I'm looking at hormone metabolites when I'm prescribing hormones. That's really, I think that's an important aspect, just to get a gestalt of what's happening in these aspects, you know, what's happening in your body with your unique genetic and environmental combination. So we can start with safe options. And I use transdermal. In my Julva cream, I put some DHEA in there and other ingredients to help that aspect, because, you know, I'm a sexual health expert and sexual health is really important. And so many people don't have the conversation beyond hot flashes for menopause, the vaginal dryness and the incontinence and the loss of pleasure and orgasm that can occur. So, you know, to help with that, I created Julva, which does have some DHEA in it as well. And that's been shown to be very beneficial to help women who are struggling.
What are the other ways that you can take DHEA? I believe that's something that you can get over the counter, right? You can order DHEA.
Yep. And typically for women, you can do oral DHEA. I like the BLA tablets. So they're a phospholipid-based tablet. I believe it's Green Mountain who makes those, and it's DHEA. And I would just start with a 5 milligram. For women, I had women come into my practice and they were on like 25 milligrams of DHEA. We, you know, with very rare exception, need that much. 5 to 10 milligrams on a daily basis and see how your body does with it. With oral DHEA, and one reason I prefer transdermal is oral DHEA, often we hear the side effect of acne, adult acne, hair loss, you know, sometimes irritability from oral DHEA. So then just start really, really low, go to 1 milligram or try a transdermal to bypass liver metabolism.
So if you're getting a topical DHEA, is that available over the counter as well, or it is?
It is. There are some DHEA, straight DHEA creams available. And you want to look and make sure that they're natural, without parabens, and gluten-free and all that good stuff.
And how do you dose those? You
So
said 5 milligrams for oral. How would you know if the cream
so
was?
yeah, and it depends on the delivery system. Like, so for me in my creation, like, I didn't find anything that I was satisfied with. So I created Julva. Julva has approximately 8 milligrams per half ml of cream. And it also has plant stem cells from the alpine rose, which is known for its rejuvenating properties and its resilience. The alpine rose is this beautiful rose that grows up in the Swiss Alps. And so for me, the harsh conditions of ice and snow, right? For me, that epitomizes women, and there's a lot of good research. So the combination, the plant stem cells from the alpine rose and DHEA plus emu oil, coconut oil, and shea butter is what I spent 3 years researching and combining to formulate Julva. So I now have, many years of experience with this product, and half ml. So, less than, 8 milligrams a day, typically to start. And then often even 4 to 5 times a week is sufficient.
Mm-hmm. So it's not something you do every day.
After the first 30 to 60 days, I would see your results. Again, we use my Julva as an anti-aging cream for the vulva. So typically to get that result, it takes 30 to 60 days. Mm-hmm.
Okay. That's interesting. That's something I'm personally intrigued by, because I know I need some estrogen. My sleep is affected right now. I'm doing the waking up really warm thing, and so a little bit of estrogen has been helpful, but I don't need very much. So this could be a good alternative pathway for me personally. So.
Yeah. And you're doing progesterone?
Mm-hmm. Oral progesterone.
To how many milligrams?
I don't know for sure. I want to say like 125.
Okay, so sometimes, because 100 to 200, typically I would write for 200, because 90% of it's metabolized by the liver. And the benefit of oral progesterone is that 90% is metabolized by the liver, and that leads to allopregnanolone and hence GABA formation, which is our hormone of relaxation. So oral progesterone can definitely help even more with getting that good night's sleep. So that might be another option. And then combine it with magnesium L-threonate and some sublingual melatonin, and that should really help.
Yeah, I do take magnesium threonate every day. So, and have for years, I think probably since about 2013. I was so intrigued by the idea that it's the only magnesium that enters the brain. And I was like, well, that's the one I'm taking. I actually take two different types, I think, citrate and threonate. So
yeah, perfect.
Very good stuff. All right, let's get to some questions from the community here. Diana said, I really want to know if there are different protocols for those who have naturally entered menopause versus those who have entered menopause surgically, minus ovaries. This is excellent. This comes up all the time, Anna. Can and should I supplement with progesterone? If so, what type? Liquid, pill, cream? We've touched on this a little bit. You can recap it. What is needed to properly absorb and metabolize bioidentical hormones? And then she just has some commentary here. No matter what I do, despite low hormone ranges, I feel estrogen dominant. I'm now currently taking a liver detox supplement. It's helped a little with breast tenderness. I was reading SAMe with magnesium may be beneficial for those with methylation issues at 54. I'm currently using BHT patch after receiving BHT pellets in August, still waiting for my testosterone levels to come down from very high levels, never doing that again.
Well, that's powerful. I want to thank her for asking the question because, again, it's a common question. So with surgical menopause, I still advocate bioidentical progesterone. And again, whether it's oral or transdermal, one of the things that I noticed as a physician was that when I started giving women who had a hysterectomy, and maybe they were only on estrogen or nothing, when I started giving them bioidentical progesterone, they would always tell me, Dr. Anna, I feel like a cloud has lifted. I feel like a cloud has lifted. And I was like, huh, how fascinating. And that dug me. Now, this is in early 2000s. That made me look into, I always have to find out why. What's the mechanism of action? And so, well, progesterone is so neuroprotective. So studies out of Emory looking at traumatic brain injury and using IV progesterone showed an improvement in outcome. Progesterone is neuroprotective. So we need it whether we have a uterus or not. The misinformation has come from the fact that so many women who've had a hysterectomy are told, well, you don't need progesterone because you don't have a uterus. And I'm sure many of our listeners today have heard that. Well, and the reason is because in the 50s, when we started using Premarin alone, that was the first, prescription widely available for estrogen replacement therapy, women started getting endometrial hyperplasia and endometrial cancer. Well, so hence why the pharmaceutical company, created a synthetic progestin. It's not bioidentical, it's a progestin, to add on to that Premarin to help oppose the estrogen effects on the uterus so that endometrial cancer rates went way down. But if a woman did not have a uterus, they were told, well, you can just do estrogen without progesterone because, you don't have the uterus to get endometrial cancer. Well, lo and behold, first of all, we don't want to use a progestin pretty much ever. And we need to use bioidentical progesterone. And that does make a difference. We know compared, it's like apples and oranges. Progestins versus progesterone work differently in our body. Progestins will have weight gain, edema, brain fog, adverse cardiovascular effects, increased risk of breast cancer. Bioidentical progesterone, we do not see that. Quite the opposite. It's a natural diuretic, a natural relaxing hormone, and has been shown to be breast protective and anyway to help with brain health in so many ways in studies that we're looking at. So quite two different beasts. So, and there are progesterone receptors, not just in our brain, but in our fascia. What do women experience as we get older and after we've had a hysterectomy too, or ovaries removed? Aching, more arthritic complaints. And then we feel like we just have to power through it. But surprisingly, there are progesterone receptors in our fascia as well. So adding that progesterone, a lot of times too, with a healthy detoxification nutrition plan, right? We want to always emphasize that. We're going to see a decrease in inflammation, improvement in flexibility, and decreased pain, and certainly that relief from the brain fog. So whether you have a uterus or not, I approach women the same way.
So the other question, that was excellent. The other question she asked here is, what is needed to properly absorb and metabolize bioidentical hormones? Do you have anything to kind of add on that front?
So one thing is, like, I pretty much over age 50, age 55, I really do prefer transdermal or vaginal hormones, okay, or buccal, or lozenges, so something that dissolves in your mouth between the cheek and gum or under the tongue. But because we need a healthy liver, and our livers are pretty well overloaded, and we know that the older we get, the more risk we have for liver disorders or fatty liver. And so we want to just, like, if we don't have to take it orally, let's not take it orally. So that's one thing. And phase 1 and phase 2 enzymatic support. So all that to say, you need healthy nutrients to help. So that here comes all our greens, dark leafy greens, adding herbs and spices, using cilantro and parsley and turmeric and garlic and, onions with good sulfur containing nutrients. So we need those aspects in our diet to help our body detoxify, and regular bowel movements. We have got to have regular bowel movements, or we're reabsorbing, hence that estrogen dominant effect, or we're reabsorbing toxins and hormones back into our body. So those, you need healthy bowel movements. You need to be, I say, keto green. You need to follow the keto green lifestyle and way to help with that. And if you don't have a healthy gut, you can, be causing more problems. So we really want, from the functional medicine doctor will always look at your gut health first in helping you get overall healthy. And so that's an important thing to address as well. Digestive enzymes, good gut health, good detoxification pathways.
Do you advocate using things like DIM or calcium D-glucarate to help metabolize estrogen in women who have estrogen dominance issues, or maybe have something like endometriosis or some other, issue going on that seems to have an estrogen component?
Can you say that again? Am I advocate of using, you broke out right there. So.
DIM or calcium glucarate for women that have had estrogen dominance problems?
Yeah, for sure. I mean, I can definitely recommend that. One of my products in my store, it's called Optimal Balance, CCC. It contains a combination of ingredients. So Vitex chasteberry, DIM, calcium D-glucarate, those are beneficial as well. So looking at things like that can definitely help as we're getting older. And then again, from our diet. So broccoli sprouts is one of my favorite things to add into and on top of pretty much every meal. So a good thing to add. So we get natural sources of DIM or indole-3 carbinol as well.
Yeah. Okay. Abby asks, what can perimenopausal women do to make the menopause transition as smooth as possible?
Yeah, great question. And one is adrenal health. And so in my book, The Hormone Fix, I talk about understanding, first of all, where are you struggling? Like which body system is maybe giving you more of a hard time so that we can address those issues first, right? But basically, you want to keep your detoxification pathways open. You want to regularly, intermittently fast, let your body rest and digest, get a good night's sleep, have healthy movement. Just a saying that we created, we used a lot in our practice is you have to think well. So think gratitude. You have to think well, sleep well, eat well, move well, feel well in order to be well.
Yeah, that's awesome. Okay. Patty asks, this is another big one in our community, to iodine or not to iodine? I was told to take a drop of Lugol's a day in a little water, and then I was told that applying a drop on each breast each night is better. Dr. Christensen says any supplemental iodine is bad if it accumulates over 50 micrograms. So is subthyroid adrenal function, is iodine good or bad? And I will just add to this that when someone talks about cysts in our community, you'll have people come out of the woodwork and say, you need an iodine protocol. And then other people will come and say, stop with the iodine protocol stuff. It doesn't work like that. It's not so easy. So that was beautiful. To iodine or not to iodine?
I love that too, because that is the question after all.
That is the question.
So again, it comes down to the art of medicine, right? So as a gynecologist, something I dealt with very frequently in my patients were ovarian cyst and breast cyst, right? And so, and iodine so my regimen to help them, if they had negative thyroid antibodies, would be iodine. And sometimes, 12.5, starting at a 12.5 milligram dosage. But that's a lot, right? That's a lot. But again, under a physician guidance and watching your thyroid and anti-thyroid antibodies. I would start with enriching your diet with sushi, seaweed, kelp, and natural iodine containing sources first, and watch for symptomatic improvement, because that's what, I rather, let's dose up on the iodine than put you through a third, fourth, or fifth breast surgery, right? Let alone the first breast surgery. So one of the things, and same with ovarian cyst, I would watch and monitor with ultrasound, whether it was breast or ovarian cyst, and titer up the iodine along with gamma-linoleic acid, so GLA, from blackcurrant oil or borage oil or evening primrose oil. So healthy essential fatty acid, healthy gamma-linoleic acid. And so GLA, you'll see that at the storage. You want to get a high quality one. But that combined with iodine therapy, vitamin D, bioidentical progesterone, that was my breast and ovarian cyst protocol. But I would watch them. So in those cases, often I have so many clients, I have young women in their 30s that have consulted with me virtually that had painful, horrible periods, like every period. I think of this one client who's 36 years old, painful, horrible periods since she can remember. And I started working with her and put her on my keto green, same program that's in my book, the keto green diet and lifestyle protocol, as well as nutritional supplements. So the Mighty Maca greens, helping your body from multiple angles, detoxify, avoiding dairy, because there's lots of hormones and other stuff in dairy, and increasing the natural iodine-rich foods in her diet. Within her second cycle, she said, Dr. Anna, I didn't even know my period was coming this round. And now she's at 8 months through, same results. So again, it doesn't matter how long you've been dealing with it, we can make a shift. And that's a natural, right? No surgery. She was threatened with surgery, but she didn't want to lose her fertility options. And she did it on her own. So,
So how would you test to make sure that the iodine was in balance? Like, what is the way to do that? So what I'm concerned about is women who are going to go kind of do the protocol road because they can't find a doctor like you to work with, you know?
Yeah.
How would they test to kind of make sure things are where they need to be?
So first, I mean, get a blood test and, get a blood test to look at your thyroid antibodies. I mean, you can do iodine testing, and typically there's a few labs that do that. You can Google it. I know Labrix is one of them. Labrix will do iodine testing in several labs, and many of them you can order your results now, and some request iodine load, no load. But I went through that whole regimen of testing iodine, not testing iodine. I mean, pretty much everyone could use a little more iodine. So that wasn't the issue. The issue was, okay, do you have thyroid antibodies or don't you? So looking at TPO, thyroid peroxidase antibodies, and antithyroglobulin antibodies, know those results, know your full thyroid panel, and we eat everyone, just like you know the numbers on your scale, there are certain lab numbers you should know. And I talk about that in my book. But, just find out, do you have thyroid antibodies or not? Now, whether you do, eating iodine rich foods, eating some, I make nori wrapped burritos, essentially burritos that are just avocado, smoked salmon, capers, of course, broccoli sprouts in there, roll that up with some sriracha mayo, my absolute favorite. And hence I have a sushi burrito, I call it, right? So use that as a wrap. You can put that in your foods, and there's a natural way to get iodine that's not going to throw your body out of balance. But look and work, look and see what works best for you. But let me tell you, I remember specifically one client in particular. In fact, I saw her daughter she was waiting tables at a restaurant. And she said, "Oh, you took care of my mom. I used to come to your office." Well, I want you to know, because until I learned these recommendations that I'm making, I would do pretty much every 6 months or a year breast cyst aspiration on her. And so I put her on this protocol, never had to do another breast cyst aspiration. Her daughter's like, she still hasn't needed any other, has had any other problems with her breast. So that's key, all through nature.
Mm-hmm. Awesome. Okay. Jackie asks, and we kind of touched on some of this, but you might want to add something to it. What are the natural ways to balance hormones as to not need hormone replacement therapy? My estrogen is fine, but progesterone and testosterone are tanked. I mean, 0. I got my testosterone back up with maca, but on compounded progesterone. I had a heart rate issue on prescription, probably from peanut oil, and I don't want to take it.
So again, one of the things is we get our hormones through our adrenals. So everything we can do to get into coherence, to increase our heart rate variability, to help restore our adrenals, to increase the oxytocin in our life, will make a difference in balancing our body naturally as much as possible. So I think definitely those are good steps to take in the right direction. So continuing regular detoxification. I definitely would say follow my keto green protocol in my book, and follow those lifestyle tips, and check, right? Test, don't guess. Check urine pH, get that alkaline, see what a difference it makes. Get your body into ketosis on a regular and interval basis, and see how that makes you feel.
Awesome. Okay. A couple more. I know we're kind of getting close on our time too, so we'll see how quickly we can breeze through these. First one is from Donna. What causes ovarian cystadenoma in menopausal women? What are the recommendations for prevention? And are there treatments other than surgery, which might include a total hysterectomy at the surgeon's discretion?
So in talking about ovarian cystadenoma versus a simple cyst of the ovary, so 2 different areas there, but anything that's causing ovarian hyperplasia. So I'd say just the same recommendations again. If it's not resolving, if I have a client with an ovarian cyst on ultrasound that I diagnose, whether it looks like a cystadenoma or not, I would look at a CA-125 and other ovarian cancer markers. Again, not sensitive or not specific, but they help with monitoring for the long haul. So there's arguments for and against doing those tests, which I'm not going to get into, but get those, right? And follow it. And so, because one number in time doesn't mean anything. So we want to look at that, and we look at the, now with ultrasound, we do 3D ultrasounds, and we look at blood flow to the ovaries, and so if we feel like it's a benign ovarian cyst, we can watch it. And just like what I discussed with ovarian cyst is another good option. So again, big with the keto green way of doing things, and also can use bioidentical natural progesterone to help. So, and just nourishing our ovarian production, our adrenal production of hormones. So through the adrenal adaptogens, and also through keeping those detoxification pathways open. I mean, that's critical to help with, our hormone symphony, the hormone communication system.
Yeah. One of the things that comes up in this community a lot, in the Healing Rosie community a lot, is the hysterectomy dilemma. Women will pop in, find our community, say, my doctor recommended I get a hysterectomy. I'm going and getting it next week. It's very, very common, as you know, for women to have issues around hormone health. And the solution is just, well, let's just take out ovaries, or let's take out the uterus, and many times women are not aware of the long-term effects of that. I have a friend who in her 20s was having super heavy periods, like bleed to death periods. It was very, very, very bad. And the solution presented to her was to have a hysterectomy, which of course is really scary because, you want to have kids, but you can't once you lose the uterus. One of the side effects that happened for her was that it affected her orgasms for life. She doesn't orgasm the same way, and she had no idea that was a potential side effect of having her uterus removed. So I think it would be a fitting way to kind of wrap this up, to talk a little bit about the whole hysterectomy question. It's very commonly prescribed. Women often don't know how to make good choices around this. So how would you handle this and inform and educate your patients?
Yeah, I think, again, when we need to do, again, a hysterectomy can be life-saving and quality of life-saving. So there are times where we absolutely need, and if we've had one, no regrets, right? I mean, we just can't look back, we have to look forward. But, many people in this dilemma, and I will tell you, Misty, that really, as I, was trained and as a gynecologist, hysterectomy was in my box as a treatment option, as well as endometrial ablation, as well as DNCs. And I went early on in my practice from doing 2 to 3 surgeries a week to 2 to 3 a year, as I helped patients heal their bodies naturally. So bioidentical progesterone detox, everything I laid out in my book. That, I just want women to have this information, because this is a guidebook, a roadmap to empower you in your healthcare journey, whether you've had a hysterectomy or you've, wherever you're at in your health, whether you're in the early stages, in your early 30s, 40s, or well past menopause, there's something in there for everyone. And these are powerful. These are empowering, because you don't just, relieve the symptoms, you improve your quality of life. So hysterectomy is intended to do both, relieve the symptoms and improve your quality of life, but often there are other consequences. So as I learned to work with clients with balancing their hormones, detoxifying them, getting them, essentially my keto green way, their bodies healed themselves. I have one client in particular, Lauren, whose story I've shared. She had come to me after her 3rd recommendation for a hysterectomy. But she was in her late 30s, and she married someone 15 years younger, and they wanted to have a baby. She was told she had severe endometriosis, would never be able to have a baby, and needed a hysterectomy. 3 doctors told her till she came to me in Southeast Georgia, right? And so she heard about me and came to me. This is now, gosh, how old is she? 18. So 16 years ago. And so I did the same thing that I'm telling all of you, is that, follow the detox program. Let's get you on some bioidentical progesterone. Let's add the adrenal adaptogens like the Mighty Maca. And let's see, let's give it a few cycles and see how you're doing and see what we need to tweak from there. And that was her story. In 6 months, she was pregnant, she's had a healthy baby, and she still has her uterus. So, I think that's the key. Now, again, sometimes, absolutely, there's no other choice. We need to do a hysterectomy. We need to remove the ovaries. And it's just, okay, well, let's make sure I, as an individual, have done everything in my power that I know now to do, and do it. And then I always tell clients, journal. If you're thinking, you want to remember how bad this time is when you go through this surgery. If you're opting for surgery, any surgery, you want to remember what you were dealing with at this time, so you don't have regrets later, that you can say, I made the best decision with the information I had for this time period in my life. And that's important.
Yeah. Talk about the cervix dimension of hysterectomy, because I understand that there are different kinds of hysterectomies. Obviously, you can keep your ovaries, just take the uterus. I've just come across information and interacting with our community about hysterectomies that don't remove the cervix.
Right.
Can you help kind of be a little more distinct and succinct in communicating than I am? So if somebody wants to explore that option, they'd know how to talk to their doctor about it.
Yeah. So it's called a supracervical hysterectomy. So you just are removing above the cervix. So typically that's recommended if you've not had any cervical dysplasia or carcinoma in situ of the cervix, that we can conserve the cervix. And that's beneficial because we're leaving all those nerves intact. That can help with the sensation of orgasm. Many women after hysterectomy still experience orgasm, but they won't experience that uterine orgasm or that contractions that they were experiencing. But if we do that supracervical hysterectomy and conserve the cervix, they may still experience that as well.
Awesome. Well, this has been amazing. I feel like I want to go listen again because I was absorbing everything.
A lot of information.
But there was a lot. Yes. So I will personally be doing a second listen, but I want to encourage everyone to sign up for Anna's free Breeze Through Menopause 10-day masterclass. I have the link right here in the status for you. And if you're on the email list, I'm also going to be sending an email out with a link and information. You can also download her What's Happening to My Hormones ebook as well. And I provided the link for that. Thank you so much, Anna, for coming on and sharing and being so flexible with all of our questions and really helping us dig in. This has been fantastic.
I love it. I love it. So I thank you for having me. And I just really want to encourage every woman listening, again, not to give up hope and be your own advocate. So listen, ask questions, and keep sharing, keep the conversation open, because we can't keep it to ourselves. More and more women suffer as a result of that. So keep sharing like you're doing. And thank you so much for having me on.
Awesome. Thank you so much, Anna. We'll see you guys later.